The National Rural Health Association is dedicated and committed to assisting our rural communities in being able to address these very insidious problems that plague our communities. The big three, diabetes, hypertension, and obesity, are certainly something that you see very highly concentrated in rural communities. And then when you couple the incidence of smoking, which only serves to complicate and many times further hasten the disease progress and make it far worse to treat in a clinical and in a community setting. What it does is basically complicates the complexity of the care, which makes it very difficult for rural communities to address the very highly comorbid conditions that result from these diseases. If you look at the map and you look at the prevalence of smoking, particularly along the southern tier of the United States and up towards the middle, you'll find that in those states you have a large number of these other comorbid conditions that I just mentioned to you. And so it's not a secret that there is a relationship between cost of care and the amount of dollars that our Medicaid programs and our health insurance programs around the country are spending in terms of treating diseases that are directly related to the incidence and the prevalence of smoking in our rural communities. And so this is a relationship. As we talk about health reform in this country, as we talk about the expensive care that's being provided on the back end of the disease process, this is one of the very important factors that will help to reduce those costs and make care affordable for every single American in this country, including those that live in rural communities. And so in that sense, we are very excited that the contribution of this report will help us in our policy efforts to be able to advocate on behalf of these policies and programs at the national level and at the state level to be able to make an impact on the terrible conditions that we see in many of these situations. So it is with great pride that National Rural Health Association commits going forward to being able to use the resources of the American Lung Association and the other groups that are assembling to try to deal with this problem. It's our intent to try to do what we can to get these reports into the right hands, make sure that people understand the problem, and more importantly, implement some of the solutions that have been very capably put together in this fine report. Thank you very much for your time, and thank you for coming to this meeting here in Kansas City. Welcome to Kansas City, by the way. My office is here, so it's great to have you here.